Hello dear friends, how are you doing today? I hope you are doing well. Welcome to a new question about dermatology. A 14-year-old male is reviewed due to a patch of scaling and hair loss on the right side of his head. A skin scraping is sent which confirms a diagnosis of Tinea Capitis. Which organism is most likely to be responsible? This question is asking about the most responsible organism for Tinea Capitis. A. Trichophyton tonsurans. B. Microsporum distortum. C. Trichophyton verrucosum. D. Microsporum audonia. And E. Microsporum canis. Okay. The choice here is Trichophyton tonsurans. Trichophyton tonsurans is the most responsible organism for Tinea Capitis. Okay, as you said, the answer is Trichophyton tonsurans. Okay, explanation. Tinea. Tinea is a term given to dermatophyte fungal infections. Three main types of infections are described depending on which part of the body is infected. Tinea Capitis is their fungal infection of scalp. Tinea Corporis is the fungal infection of trunk, legs, or arms. And Tinea Pedis is the fungal infection of feet. Okay, Tinea Capitis or scalp ringworm. The cause of scarring alopecia is mainly seen in children. Tinea Capitis is the cause of scarring alopecia and is mainly seen in children. If untreated, a raised pustular spongy or bulgy mass called a carrion may form. The most common cause is Trichophyton tonsurans in the UK and the USA. As we said, Trichophyton tonsurans is the most responsible organism. May also be caused by Microsporum canis acquired from cats or dogs. Diagnosis is usually with lesions caused by Microsporum canis exhibiting green fluorescence under wood lamp. Okay, diagnosis. In Microsporum canis, lesions usually show green fluorescence under wood lamp. However, the most useful investigation is scalp scrapings. Okay, this is important. The most useful investigation is scalp scraping. Management of tinea is usually with oral antifungals like terbinafine for Trichophyton tonsurans infections and griseofulvin for Microsporum infections. Okay, and topical ketoconazole shampoo should be given for the first 2 weeks to reduce transmission, and this is important if we are giving terbinafine or griseofulvin to the patient, but we must also give topical ketoconazole shampoo to avoid transmissions for the first 2 weeks to avoid transmission. Okay, as we can see here, this picture is showing Tinea Capitis or scalp ringworm, and we can see here bulgy or spongy mass, which we call it carrion. Carrion is formed here, and we can see here also Tinea Capitis or scalp ringworm in this young man. Okay, Tinea Corporis or ringworm. Tinea Corporis, as we said, is the fungal infection of trunk, legs, and arm. Trunk, legs, and arms. Okay, Tinea Corporis or ringworm of the body. Causes include Trichophyton rubrum and Trichophyton verrucosum. In the Tinea Corporis, the responsible microorganisms are Trichophyton rubrum and Trichophyton verrucosum. Example, from contact with cattle. If the question was asking about Tinea Corporis, then the answer would be Trichophyton verrucosum, but if the question is asking about the Tinea Capitis, then the answer is Trichophyton tonsurans. Okay. Okay, causes include Trichophyton rubrum and Trichophyton verrucosum. Example, from contact with cattle. Okay, well-defined annular erythematous lesions with pustules and papules, as we can see here. We can see well-defined annular erythematous lesions with pustules and papules. Here we can see well-defined border also in this patient with Tinea Corporis. Okay. Management is usually with topical antifungals like clotrimazole, miconazole, and terbinafine creams or ointments. But in extensive or resistant cases, oral antifungals like itraconazole or fluconazole are useful. In Tinea Corporis, the treatment is usually with topical antifungals, but if the lesion is extensive or resistant to treatment, we can use oral antifungals like itraconazole or fluconazole. Okay. Hygiene practices. Hygiene is really important in fungal infections. We must say the patient to keep the affected area clean and dry. They must avoid sharing personal items and wash clothing and bedding regularly to prevent spreading or recurrence. Okay. Tinea Pedis or athlete's foot is characterized by itchy, peeling skin between the toes, as we can see here. We can see Tinea Pedis or athlete's foot in these photos. Okay, it's characterized by itchy, peeling skin between the toes. It's common in adolescence, as we said. The Tinea Capitis was common in children, but the Tinea Pedis is common in adolescence. Management is usually with topical clotrimazole, miconazole, terbinafine, or tolnaftate. But in severe cases or when topical treatments fail, oral antifungals like terbinafine or itraconazole may be prescribed. Preventive measures. Prevention is always already better than treatment. Okay, you must say the patient to keep feet clean and dry. They must wear breathable footwear and they must avoid sharing towels or footwear to prevent recurrence. Okay. Note, lesions caused by Microsporum canis exhibit green fluorescence under Wood's lamp. However, the most useful investigation is scalp scrapings, as we mentioned above. Lesions due to Trichophyton species do not readily fluoresce under Wood's lamp. Okay. Was a short explanation about the body fungal infection. We have another type of fungal infection which involves the fingernails or toenails, which we call it onychomycosis or fungal nail infection, and we explain it in our YouTube videos, the management, the treatment, and the presentation. For more information, you can watch it. Thank you for your attention.